Like I've been using Botox for many, many years, and I've said to you when you do my Botox, I need to move my face, and I always say, no, just make sure I can still move my face. And every time I walk out of there, I look natural. I can move my eyebrows. I can move my face. I can make facial expressions. And that is how Botox is supposed to be done. It's not supposed to be where you can't, your eyebrows are just stuck in this surprised kind of look. Or,
right.
I've seen people who Botox their lips where they can't smile correctly, or they've overfilled their lips to where they look like ducks. And that is not what unfortunately, when people hear Botox or they hear filler, they go immediately to the housewives. They go immediately to these cases where they look awful, but they don't know all the other actresses that look natural. And because those actresses aren't going to say anything. They don't say, I use Botox, I do this. And those actresses, which I'd say probably 60, maybe 70% of older actresses do have filler, do have Botox, but it's done so well, you don't know. And that's the kind that's the kind of injectables you want to use. And that's the kind of doctor you want to use. Somebody who's going to keep you looking natural. So, I mean, Dr. Shieh, every time I've walked out of there, all I get is compliments. Nobody will ever guess my age. And I love that. And there's two other people I definitely want to introduce right now. Two guests. They're testimonials. They're Dr. Shieh's patients. We have Anita Lee and her daughter, Jennifer Lazo. So, hi. Don't be shy. I actually asked for you, Anita. I said, I saw a woman in the waiting room.
In tears.
In tears. No, but you weren't in tears when I saw you, but you did have I guess it would be called the pregnancy mask. It was all over your face.
All over my face.
Yeah.
Oh.
And
I was a mess.
And I said, I want her to come on the show. How does she look now? And they said, no, it's not only her, it's her daughter too. They've been coming and getting treatments. It's unbelievable what they look like. I said, could you ask them to come on the show? So can you talk a little bit about your case and what went on?
Oh, sure. About a year ago, I started getting on upper lip. Well, we call it baño, but like a mustache. And it was just awful that I didn't want to go anywhere. So my daughter gave me a birthday gift, and she says, I'm going to take you to a doctor that's going to fix it for you, Mom. I says, really? I said, there's doctors that can do that? I mean, I tried creams and everything, and nothing would help. So she took me to this doctor recommended by a friend. So I went for one visit, and when we came back within 2 weeks, not only did my mustache get darker, but I got it on my cheeks, my jaws, my forehead, my eyebrows. And we left in tears. And then she says, Mom, I'm going to call Dr. Shieh. He's going to fix it for you. I says, Jenny, I don't want to go anywhere. I says, I just want to go home. Well, she called Dr. Shieh. I was kind of reluctant to go, and I thought, oh, no, they can't do anything for me, So we went, and he has a great staff. They encouraged me. He told me within 6 to 8 weeks. By the 5th week, maybe the 3rd day after that, oh my God, I wanted to run to Dr. Shieh's office and say, look at it, it's finally working, And I've been so pleased. And everybody has told me I don't have to wear the heavy makeup. My face looks great. I use the lotion, vitamin C for, I guess, wrinkles.
Yeah, the vitamin C and the Skin Bright as well. Do you do the Skin Bright? It's phenomenal.
And so I'm very pleased. And when he told me that, he wanted me to come on, I says, I'd be happy to come. Anything I can do, because there's a lot of people out there my age and will shy away, says, no, we're stuck with this face, Yeah. And what he did for me, I mean, I couldn't say enough about it,
Oh, so it basically, it changed your life. Did you?
Oh, yeah.
I mean, your skin's so gorgeous. I would never know that you had any discoloration.
Oh, until you see those pictures.
And yes, in which we're putting up now.
So, Dr. Shieh, what was the first, did she have just a laser treatment before that made the melasma worse?
Oh, yes. I had this treatment with this other, she's not so a doctor, but she gave me this treatment. And I think it was just she must have thought I just had like spots, and it wasn't that. She didn't know that I had, well, I didn't know this. I just thought it was, well, we call in Spanish, baño, again, it's like when you're pregnant, but I haven't been pregnant in over 40 years, and it just came. And no, she treated me terribly wrong.
Yeah.
You know?
Yeah. I think that's a cautionary tale because on every corner, at least in Los Angeles, there's laser ads and little, med centers. Oh, come in and get laser treatments. I would never feel comfortable unless it was someone like Dr. Shieh, because I think there is a lot of risk involved when people don't know what they're doing.
Absolutely. And then Jennifer, you had like dark spots as well.
I did. About 3 years ago, I developed 2 dark spots on each side of my cheek. And like herself, I did the creams, followed my mom's advice. Nothing would work. And I just felt so embarrassed. You didn't want to look anybody in the eye because you didn't want to see them looking at your face.
Yeah.
So another friend had recommended RejuvaYou and to go see Dr. Shieh. And I did a photo facial. Oh my goodness. After a week, my face was beautiful. I mean, never could I have gone out without no makeup, and it looked as though I had makeup on. It was just amazing.
I am so with you because I always had to wear makeup. And when you can actually run to the grocery store, go get a coffee, or just do something without makeup on and not feel embarrassed,
right?
It's amazing. It's the best. It's like freedom. I sometimes come to work and I'm not wearing any makeup, and I mean, and my co-host on one of my other shows teases me. He's always like, well, it's your age. You got to wear makeup at your age. Not wearing anything. But yeah, no, it really does change people's lives.
It does.
It did mine.
Yeah.
Very much.
Yeah.
I so much confidence. Back to myself again, I would know when I would come into the office, thank God she was always there and encouraged me, and all his staff encouraged me. I says, how you doing? I says, I'm doing okay.
Yeah.
But down deep, I just wanted to cry. I says, Jenny, this is not working. Jenny, this is not working, but we went faithfully and it finally worked.
It's so great.
Now, it is. That is wonderful. And you were saying at your age, or you were commenting about, at my age, but the spectra can be used pretty much from your teens on up.
Yeah, the spectra, it's a treatment that really is for everybody. I mean, if you have a condition such as any kind of aging, if you feel like you need a little boost or glow to the skin, spectra is a good one because there's no downtime. It's very easy to do. It's probably the most comfortable of all the laser treatments that we offer. So people really love it for that purpose. And then if you happen to have melasma, it's perfect for that. But you can get melasma whether you're in your teens, because, even birth control, pregnancy, on into people, and even after menopause, you could get melasma. Just because your hormones have declined, there are still some other hormones that are in the body from stress, other things that can trigger that. And then, of course, sun exposure. So the story we hear with Anita and Jennifer, it's probably the typical kind of common story. And actually, it's probably much more prevalent than we think.
Yeah.
And then their experience with maybe getting a laser done and then worsening the melasma, that's actually very common. And it also reflects the lack of awareness about it, because this doctor or nurse that had treated her, which wasn't in our practice, didn't know how to recognize the melasma. And so what happens is they treat with the different device that's not appropriate, and then ends up worsening the condition. And it really brings out the rest of the melasma. And then luckily we can utilize the spectra now. I mean, if it was a few years ago, we didn't have this option, but now we can use the spectra, and it is a series of treatments that we have to do over time.
Now, I know that I went in and I had, before I knew that I had melasma, I had all the IPLs. I had the matrix and everything, and it would go away for a little bit. And like you, Anita, it would come back so much darker. And I kept thinking, I was so frustrated. What is going on with my face? What is happening? And yeah, you have to go to somebody who can recognize it's hormonal. That's melasma. That's not sunspots. That's, I kept thinking, maybe my sunscreen's not, strong enough. I have to wear, I even tinted my windows. This is no joke. I have UVA on my windows because I kept thinking, okay, I must have really sensitive skin. And then I realized, okay, it's melasma. And I thank God for Floyd. That's all I can say. Floyd was the one who recognized it. You know, when I said, "Hey, I keep having these dark spots," but Floyd, I know that you are an aesthetic consultant at RejuvaYou. You must see a lot of women who come in and who are really upset or about or embarrassed.
We actually see it quite often. So when the Spectra came out, when Lutronic came out with this device, I was so excited because all of these consults, I mean, I'd go in and I'd look at their skin and I'm like, I'd recognize that it was melasma. And previous to this, we were doing bleaching creams. But the problem when you're doing bleaching creams and all the different things, there's irritation, there's sensitivities to the sun, there's a lot of peeling, and there's a lot of downtime involved with all of these other ways that we were treating the melasma before. But now with the Spectra, the best thing I could tell a patient was you can come in, it might be 20 minutes to numb your face. And then some people don't even use numbing cream.
I don't. It doesn't hurt. So I don't know why you'd numb somebody. Are they scared of the laser? Is that why?
Well, I think it's the pitter patter because it goes.
Oh, it does. It makes a loud noise.
It makes a little bit of a scary noise.
But it doesn't hurt. It actually tickles. I laugh sometimes when it goes on my face. Yes.
She's a masochist.
I was not laughing.
It tickles me so much. I'm like, stop, stop, stop. And I start laughing. But yeah, I guess everybody's sensitive to, you know, different sensitivities. But yeah, it's you're in and out.
You're in and out fast.
Yeah.
There's no downtime and your skin looks better than ever. Your pores, everything, the texture, things look great, looks really bright. So it's one of my favorite treatments. It's really recommended to patients. And I always tell them, you can come in and in 15 minutes, you're going to look great. You're going to feel great.
Yep.
I think with women, most of us want to get a treatment where you get results and then you feel great after and you can see the difference
immediately. And you can go out the next, I mean, you can go right back to work. It is really what they call that lunchtime peel. You can run in. I mean, it's so quick. If you don't do the numbing, it takes me 15 minutes. I'm in and out. If you do the numbing, it's about a half hour. You're in and out and you look phenomenal. And I have, unfortunately, I have more hair than I'd like on my face.
She's a furry creature.
I'm a little furry, but